My name is Kara Levinson. I'm a 2018 Laboratory Leadership Service Fellow with the Centers for Disease Control and Prevention, and I'm a field assignee to the New Hampshire Public Health Laboratory. And what I presented on, I gave a TED-style presentation sharing a Legionella outbreak we experienced in the state of New Hampshire in August of 2018. And there were a record number of cases. This was the first legionellosis outbreak we had in the state in more than 50 years. And we identified 34 cases of individuals with legionellosis, 2 of whom died. We were able to link it to a hotel hot tub. And what we learned most from the outbreak investigation and the sampling was utilizing kind of traditional likely and unlikely public health partners. So working with our local health officials, those were our police chiefs and fire chiefs, with our neighboring state health departments that also had cases involved in the outbreak, as well as knowing who the private laboratories and consulting companies in our state, because they also became involved in the investigation as well as the remediation and follow-up. And the second lesson we learned from the outbreak was to really utilize the public health laboratory every step of the way, both in sampling, in the environment, trying to figure out the source of the outbreak, how to interpret the test results, and use that to kind of guide our public health order implementation and our communication of risk to the public, and ultimately to end the outbreak and communicate that with the business owners also implicated in the outbreak of what they can do for a long-term water management plan. We relied heavily on the laboratory every step of the way. And what was also useful and really critical to this particular outbreak is being able to link the clinical isolates from people who had been infected with Legionnaire's disease to the environmental samples, and the isolates we found at the hotel hot tub was by getting the respiratory specimens. A lot of Legionella outbreaks, they use a urinary antigen test, and if that's negative, that's all that they do. But if Legionella is on the differential, if you have someone that you suspect might have Legionnaire's disease or Pontiac fever, it's really critical to get a respiratory specimen and send it to your laboratory, and that helps us with the investigation and follow-up.